Hello everyone. So we will begin with the cardiovascular system, which begins with the 33,000 and it goes on till 38,000. And in this particular system, we are going to learn pacemaker and defibrillator, and of course the coronary artery bypass surgery and some other important topics. So in the new format of the AAPC CPC exam, you will have 6 questions on the cardiovascular system, and roughly you will get 15 minutes to answer. And there are at least you will expect one operative report on this system. And the topic which we are going to cover are the following topics. CPT coding for the pacemaker and defibrillator. The code range is from 33202 to 33273. The code talks about insertion, removal and replacement. There are many codes which are out of numerical sequence. So this topic or this particular section is very challenging because the codes are out of numerical sequence. The code range preceded by the extensive coding guideline. Pay attention to a lot of parenthetical notes, and there is a reference table. If you can master it, it is well and good. So what is a pacemaker? Pacemaker is a device which uses the electrical pulses to prompt the heart to beat at a normal rate. Pacemakers are used to treat the heart rhythm that are too slow, fast or irregular. So these abnormal heart rhythm, which are called as a arrhythmia, that is absence of the rhythm, pacemaker gets them into the rhythm. And we have a natural pacemaker in our heart, and that is called as a SA node. Sometime in the exam they do ask that. So let us understand what is this pacemaker. So the pacemaker system has the two important components. The first is pulse generator. The pulse generator is nothing but a battery. The battery on which this pacemaker works. And second is leads. These are also called as a wire or the leads. And it has an electrode in the lead. Now, the pacemaker system, these leads, they are placed in your body through the vessels, which are called as a transvenous, or they can be put directly on the surface of the heart by doing the thoracotomy. That is, you will cut open the chest, expose the heart, and put this lead. Epicardial placement is usually we follow in the pediatric patient. So depending upon the approaches, we call it as a transvenous, where the leads or the wires are inserted through the vein. So in your documentation, there will be the mention of the leads going through the subclavian vein, or and then you should understand that it is a transvenous. Epicardial, it is lead inserted on the surface of the heart and is requiring a thoracotomy. So whenever there is a epicardial lead placement, pay attention to the word thoracotomy, cut open the chest, or surgical opening of the chest and then putting the leads. And nowadays, the new pacemaker which has come, which is called as a leadless, lead means wire, so there are no wires and we put this capsule directly into the chamber of the heart. Now, if you see the pacemaker has single lead, dual leads or multiple leads. Single lead is whenever the lead is inserted either in the right atrium or into the right ventricle. Dual leads means it has two leads or two wires, and they are inserted one in the right atrium and one in the right ventricle. And multiple leads, which is more commonly also called as a biventricular, where we will have three leads. One is in the right atrium, one is in the right ventricle, and one is into left ventricle. And this is very important from the pacemaker part. Whenever we are doing the question related with the pacemaker, one must know that what is happening in that scenario. Is there a insertion, repair, replacement, reposition, or the removal? And are we coding for the pacemaker or the defibrillator? Because the codes are different. Then how are we putting that system? Is it through the transvenous, that is through the vessels, or are we doing it open, that is thoracotomy approach? And the system can be permanent or the temporary. And whether it has single lead, dual lead, or lead in biventricular or the left ventricle. And permanent is usually located inside the body and temporary is located outside the body. So This is the table for insertion of the complete system, and if you study the table carefully you will realize that the first code 33208, it talks about generator and leads dual chamber, that is a right atrium and a right ventricle. If it is a generator and a single lead, and if that single lead is going into the atrium, we have the code 33206. And if it is a generator and a single lead, and if it is going into ventricle, we have the 33207. But if we have the lead which is going into the left ventricle, then how do we code it? So we code, suppose if there is a biventricular, that is you have two leads in the ventricle and one lead is in the atrium. So I will code for the dual chamber, that is this code, and for that additional lead which going into left ventricle, I will code 33225. And if it is a generator and a single chamber lead with a LV, that is you have one lead which is going into right atrium and the second lead it is going into left ventricle, then I will code 33206 and 225. And if it is a right ventricle and a left ventricle, I will code like this. So this is a very important table, and make this observation. So most of the codes are for the conventional system, and if you are adding the placement of the LV lead, then we have to be extra careful, because if you are placing the LV lead into the existing device which is already there with the patient, then I am going to code it 33224. But if I'm putting the LV lead at the time of the placement of the entire system, that is when we are putting the new system in the patient's body, at that time only I am introducing the LV lead, then I'll be coding 33225. And if I am just repositioning the LV lead, I will code it 33226. So these are the code for the insertion of the generator only. Generator means the battery. Pulse generator means the battery. And the codes are for the pacemaker, and these are the code for the defibrillator. And the code differs depending upon the number of the lead. So if I am inserting the generator into the single lead system, the code is 33212, and so on and so forth. So these are the code for the insertion of the leads. Now insertion of the new lead is when one of the lead is not working properly, then they put the new lead. And if you pay attention to the codes varies. Like if you are putting two leads, then the code is 33217. If there is only one lead, the code is 33216. And if you are putting the LV lead, it depends whether you are putting it in the already existing system, or are you putting it with the new system itself. So if it is already existing system, it is 33224. And if it is along with the new system I am putting LV, then I will code for the regular system plus add-on code for the additional lead. So this is very, very important. And these are the code for the defibrillator, and they are same. So the leads codes are same for the pacemaker and defibrillator. Now let us look at this code. These codes are for removal without replacement. Now sometimes what happens is when the patient is undergoing for some kind of procedure, they don't need the lead. So that time we take out the lead. Usually the transvenous leads are, removal is very uncommon. What we do is we just cap the lead and leave it into that place. But if you are taking out the lead and you are not going to replace it, then you have the code for the double lead, that is RA and RV. We have the code 33235, and single lead we have the code 33234. And if it is a removal of the generator without replacement, we have the code 33233. And the ICD codes here are different. Okay, so everywhere pay attention to all the codes. Now what is replacement mean? Replacement means codes include removal of the old device and placement of the new device. Replacement codes are only used when the exact same type of device is removed and replaced. So that is also very, very important. So now we are looking for replacement. Now I want you to take attention. I want your complete attention. This is the table for the removal with a replacement of the same type of device. The first three code is only for the removal of the generator and followed by its replacement. And the codes are 33227, 228 and 229. And here the code differs depending upon whether we are removing the generator from the single lead system, dual lead system, or multiple lead. And the code is a combo code. It talks about 2R. What are those 2R? It talks about the removal, okay, and it talks about the replacement also. So we don't have to use additional code. Now let us look at the following three codes. These three codes are the complete removal of the system and followed by replacement. So we are removing the generator as well as the lead and replacing it. Now take a look at the codes. But for that we are using three codes. Why we are using three codes? Because if you see the code 33233, it talks about removal only and removal of the pulse generator. Okay. Then 33234, it is also talking about removal of the electrode, and we are talking about the single system here. Again the code differs depending upon the system. And then we write the code, third code is 33206. It is the insertion of the new or the replacement of the permanent pacemaker. So what we do is, suppose this is a system and we are replacing this system. So what we will do is, first we remove the pulse generator and then the lead, and then we replace it. Replacement is by one code, but removal is we have to remove this separately and remove this separately. So this is very important and you need to read the code language carefully. So these are the code for the system upgrade. And what is the upgrading means? Upgrading means when we are when there is a single chamber pulse pacemaker or defibrillator that we are changing into dual chamber, or we are adding the left ventricular lead into the conventional system. That is called as a system upgrade. And depending upon that we have the code. So the conversion from single chamber to dual chamber, we have the code 33214. Upgrade to CRT with the placement of LV lead, we have the code 33224. And upgrade to CRT with the placement of LV lead with a generator change, no generator change, that means it is the existing system. With a generator change, that means you are putting a new system because you are upgrading the LV and putting the A, you have the code 33225 plus 33228 and 229. These are for the generator change. Okay, so you have to be that particular. Now these are the code for the repositioning, repair and revision. Repositioning of the lead, then we have this code, and this is very important because the pocket revision during the device replacement is not coded separately. This is very important. Repositioning of the leads refer to the cardiac portion of the lead, and moving the lead to a newly created pocket without repositioning the cardiac placement is bundled in the pocket relocation code. So this is very important as far as the reposition and repair and revision concerned. So this is the defibrillator, and the outer look is pretty much similar to that of a pacemaker. It also has the two components. One is the pulse generator, that is nothing but a battery, and the leads or the wire, and it has the electrode at the end. The defibrillator treats the fast or irregular heartbeat by delivering a shock to restore the normal rhythm. So the function is, the pacemaker gives the slow shock while the defibrillator gives the rapid shock and get the rhythm back into its normalcy. So the codes for the defibrillator are from the 240 onwards, and if you study the code, they are pretty simple. Removal of the pulse generator, then insertion of the electrode, and if you see these two code here, the removal of the pulse generator with replacement. So there is no separate code for the removal and the replacement. So you need to read the code language very carefully to code it properly. Now let us take some questions that will, make your concept more and more better. So the physician removes the 60-year-old male patient's old pulse generator on a dual lead system, that is a defibrillator system, and replace it with a new one. What are the correct code for this surgical procedure? So you should have a drill in your mind. First of all, what is the system? It is a defibrillator. Then secondly, what they have done with the system, they have removed the old pulse generator and replaced it with the new one. And how many leads the system has? Dual lead. So we have enough data for us to eliminate all the wrong options. Now we need to check. Here the code 33230, it is a this is the indented code, and the main code is insertion of the implantable defibrillator pulse generator only. Now in this case what has happened is old pulse generator was removed and it was replaced by the new one. So you should know what has exactly happened with the patient in the patient's case. Then 263 is a removal of the implantable defibrillator pulse generator with a replacement of the implantable defibrillator pulse generator. So that is the code 33263. And 33241 is removal of the implantable defibrillator pulse generator only. Now this code talks about both and this code talks about only removal. So when one code includes everything, there is a guideline in CPT that whenever we have the the combined code that is talking about removal and replacement, then we will use that code over only the removal code and replacement code. So in this case, this code talks about both, while this code talks about only removal. And if I have this combined code, I will use that. Okay, so this is the wrong option. Now in between these two, we will finalize our answer. So C is the correct answer because 33263, it is an indented code, and I will read the code: removal of the implantable defibrillator pulse generator with replacement of the defibrillator pulse generator dual lead system. And that's what happened in our patient's case. Now this is an operative report where you will have a lot of information to gather. So whenever you are solving this kind of a question, write down what has happened. 79-year-old male with a symptomatic bradycardia and syncope is taken to the operating suite where the insertion of the pacemaker will be performed. After the anesthesiologist provided a moderate sedation, the cardiologist performed a left subclavian venipuncture was carried out. A guide wire was passed through the needle and the needle was withdrawn. A second subclavian venipuncture was performed. A second guide wire was passed and the second needle was withdrawn. An oblique incision in the deltopectoral area incorporating the wire exit side. The subcutaneous pocket was created with a cautery on the pectoralis fascia. An introducer dilator was passed over the first wire and the wire and the dilator were withdrawn. The ventricular lead was passed through the introducer and the introducer was broken away in the routine fashion. A second introducer dilator was passed over the second guided wire and the wire and the dilator were withdrawn. An atrial lead was passed through an introducer and the introducer was broken away in the routine fashion. Each of the leads were sutured down to the chest wall with a 2-0 silk suture each. Connected the leads to the generator, curled the leads, and the generator was placed in the pocket. We assured the hemostasis. We assured the good positioning with the fluoroscopy. What is the CPT code? Let us have our drill. What is the system? The system is pacemaker, and where an insertion of the pacemaker will be performed. So they are putting the system for the first time. A pacemaker system is putting for the first time and it is a permanent system. See, remember, whenever it is a temporary system, they will mention that. And if they don't mention what kind of a system it is, we can assume very well that it is a permanent system. This is a very important guideline. So we have a permanent system which is a pacemaker and it is a dual lead. How do I get that information? Atrial lead and the ventricular lead. So I have enough data now with me and I will zero down my answer. So you have the code 33206, insertion of the new or a replacement of the permanent pacemaker with a transvenous electrode atrial. What is the system? How did they do it? Through the vessels, because subclavian venipuncture was carried out, a guided wire, and there is no mention of the word thoracotomy because epicardial lead placement is by the thoracotomy. So we will require the various code. 33208 is a atrial and ventricular lead. This is only the atrial. We have used the two leads. So we have 33208. 33212, it is the insertion of the pacemaker pulse generator only. Now, whenever we are introducing a new system, we have a single code which talks about the introduction of both. I mean, they don't talk separately, but the code language insertion of the new or the replacement of the permanent pacemaker with a transvenous electrode. So this is the system code. That means I am putting the system for the first time. Okay, 33226, it is the code for the repositioning. Repositioning didn't happen in our case. 33235, it is the code for the removal of the transvenous pacemaker electrode single lead system. Removal didn't happen because we are putting the pacemaker for the first time. Now we have a data, we'll zero down our answer. So after eliminating all the wrong answer, our answer is 33208. It talks about the insertion of a new or replacement of the permanent pacemaker with a transvenous electrode. This is atrial and this is atrial and ventricular. Okay, so that's our answer. So Mr. Yuri present to the outpatient surgery for the replacement of the permanent dual chamber pacemaker. The procedure involved a removal and insertion of the atrial and ventricular leads, which were placed under fluoroscopic guidance via the subclavian vein. Testing confirmed the appropriate placement and conduction. The left chest was infiltrated with epinephrine and pocket was opened for the replacement of the generator. The leads were attached to the generator and the generator was programmed. Appropriate pacing was confirmed and the skin pocket was closed in layers with a dressing applied. What are the appropriate CPT code? Now let us have our drill. What is the system? Permanent pacemaker. How many leads? Dual lead. What they have done with the system? They have done the removal followed by replacement. And so we will eliminate all the wrong option. Now the option D, these are the code for the defibrillator. So we are going to take out that, we are going to eliminate that option first. Then we are left with three options. 33208, it is when insertion of the new or the replacement of the permanent pacemaker with a transvenous electrode. So of course we will require this code, and 33208 is for the dual chambers. So we will require the 33208 code. But what are these two codes? So remember, if you know that whenever we are replacing the system, first we have to remove the old system followed by the replacement. So let us zero down our answer. So the correct answer is answer B, because what is the code? 33233, removal of the permanent pacemaker pulse generator. So we are removing the pulse generator. Then 33235 is removal of the transvenous pacemaker uh, electrodes single lead, but ours is dual lead. So 33235 we will require. This is taken down pulse generator, taken down electrode, and 33208 is placement, insertion of the new or the replacement of the permanent pacemaker with a transvenous electrode, and 33208 talks about the dual chamber. So we will have that code. So this is what the answer is. So let us take next question. Mr. Rodford present to the outpatient surgery for replacement of the dual chamber pacemaker after the multiple attempt to manage his bradycardia medically. Atrial and ventricular leads were placed under fluoroscopic guidance via the subclavian vein. Testing confirmed the appropriate placement and the conduction. The left chest was then infiltrated with epinephrine and the pocket was open for the placement of the generator. So what they have put is the placement of the generator. The leads were attached to the generator and the generator was programmed. The leads were attached to the generator and then the generator was programmed. Appropriate pacing was confirmed. The skin pocket was closed in layer and the dressing placed. So let us have our data. It is the placement of the dual chamber pacemaker, and it is done via transvenous route because via the subclavian vein. So we have enough data that they are putting the system for the first time. It is a dual chamber and it is a permanent pacemaker because there is no mention of the word permanent, and when it is not there we can assume it is a permanent system, and so we will use all that data and we can zero down the answer. So it is the putting the new system with the dual leads for the first time, and that is your main a data point, and then you zero down your answer. So our answer is 33208 because this is a code for an insertion of the new dual chamber pacemaker. And this is a kind of a combo code because whenever I am talking about insertion of the new system, it includes the insertion of the leads as well as the pulse generator. And there is, so rather than using the individual code of insertion of the leads and insertion of the pulse generator, if I have a combo code, I'll pick it up that. And that's why the answer is A. A 60-year-old female retired professional dancer sustained a heart attack 3 months ago. She present today for the placement of the transvenous biventricular defibrillator system. Which code best describe this encounter? Now let us have our drill. What is the system? Defibrillator. How many leads? 3. Why? Because it is a biventricular system and they are putting the system for the first time. Now we have enough data. Let us eliminate the wrong option. Now the first A is 33208 and I know that this is a pacemaker system code and our system is defibrillator. So I am going to eliminate option A. 33224 and 225, we are going to check what is the difference. 33224 is the insertion of the pacing electrode cardiac venous system for a left ventricular pacing, and left ventricular pacing is biventricular with the attachment to a previously placed pacemaker or the implantable defibrillator pulse. So I use this whenever I am introducing left ventricular lead into already existing system, and 33225 is the insertion of a pacing electrode cardiac venous system for a left ventricular pacing at the time of insertion of the implantable defibrillator. So I will use the 33225 when I am introducing the left ventricular lead along with the new system, because the conventional system is only for the one lead and the two lead. Okay, so remember that. So this is an add-on code. Okay, so enough clue we have. Now we will zero down our answer. So from the previous slide explanation, we know that we cannot have both these two code together. Okay, because one talks about LV lead in the existing system and one talks about LV lead in the new system. So this itself is a wrong option. Now in between these two, the deciding code is this and this. This is the code when I am giving the LV lead in the new system, and this is the code when I am giving the LV lead into the existing system. Remember the conventional pacemaker and the defibrillator that is available in the market, it is only with the single and the double lead. So if I am adding an additional lead, that I had to code it separately, and that I will code it depending whether I am adding the lead at the along with the new system, or I am upgrading the system, that is whether I am adding the lead into the already existing system. In my patient, I am adding the lead into the new system. So 33225. Mrs. Rice had a temporary ventricular pacemaker electrode placed at the start of the procedure. This temporary system was used as a support during the procedure only. How would you report a temporary system? Remember, the temporary pacemaker, we use it whenever we are doing certain surgeries on the heart, and that time we will require this pacemaker. So here they have very clearly mentioned what is the type of system: pacemaker. In the pacemaker also, is it a permanent or a temporary? It is a temporary because it is very clearly given in my patient documentation. So I am looking for temporary ventricular pacemaker electrode. So let us see all the code. Remember, there are only 3 codes for the temporary pacemaker. So in your book you can put the asterisk in front of this temporary system, so easy for you to understand. So let us look at the answer. So the answer is 33210, insertion or the replacement of the temporary transvenous single chamber cardiac electrode or a pacemaker catheter. So this is where they have put a ventricular pacemaker, only one chamber single chamber cardiac electrode of a pacemaker catheter. Uh, so this is the code that we will select, and this is for the dual chamber. They have not said something about the dual chamber. Ventricular pacemaker, only one. And that's why that's the answer. Require a conversion of the single chamber pacemaker system to dual chamber system. The previously placed electrode was removed transvenously, the skin pocket was opened and the pulse generator was removed. The skin pocket was relocated and the dual system was placed with transvenous electrode in both the right atrial and ventricular chambers. The system was tested and the new skin pocket was closed. The patient tolerated the procedure well. How to report these services? So now we have the data and there is lot to observe. What has happened is the patient single chamber system was converted into dual chamber. So the upgradation of the system has happened and now they have moved to dual chamber. The skin pocket was opened, the pulse generator removal happened. The skin pocket is then relocated and then the new electrodes were put, they are tested. So let us see what are the options. So first of all, eliminate the absolute wrong option. And if you see the 33249, it is the code for the defibrillator. So I will not require this code. And so C is the wrong option. Whenever you have a multiple codes, if one code is also wrong, that particular option is wrong. Now we will see the different code. So let us see B and D. Now in this case 33214, it is talking upgrading of the implantable pacemaker system, conversion of the single chamber to dual chamber system, include the removal of the previously placed pulse generator, testing of the existing lead, insertion of the new lead, insertion of the new pulse generator. This is the code which includes almost everything that is there. So this is the kind of a combo code and I'll definitely require this code. So I'm going to use this code. What is the code? 33216, insertion of the single transvenous electrode. Now, if the code 214 includes everything, insertion of the electrode, then I don't have to use this code again, because then it becomes you are using the code again when this code includes everything. So this code and this code, they don't go together. So B is also not the correct option. Now in between A and D. So let us see what's our answer. Yes, so the answer is D. This talk about the upgradation of the implantable pacemaker system, and 33222, it is the relocation of the skin pocket for the pacemaker. And that has happened and that's why we will write the answer D. And 51 modifier is then for the additional procedure. This is the additional procedure that we have. Patient had a dual chamber pacemaker put in 2 days ago. He is having a problem with the battery and the cardiologist found that it is malfunctioning. He is taken to the operating suite and replaced the pacemaker battery. What CPT or the ICD codes are reported? Now let us collect our data. What is the system? Pacemaker. How many chambers? Dual chamber. What happened? That the battery, that is a pulse generator, was malfunctioned within 2 days. Okay, and so what the doctor is doing? The doctor is taking out the old pulse, taking out the malfunctioned pulse generator and replace the pacemaker battery. That is a pulse generator. Check the code 33226. It is the repositioning of the previously implantable cardiovenous system. Repositioning didn't happen. We are just replacing the defective battery. 33235, it is a dual lead system. Okay. 33228, it is for the removal of the permanent pacemaker pulse generator with a replacement of the pacemaker pulse generator, single lead and dual lead. So I will require a code 33228, and 33213 is with the existing dual lead. So kindly see all these codes in the bracket. Now let us look at the modifier 76, 52, 78 and 58. So what is this modifier talks about? Let's see the answer. And the 78 is unplanned return to the operating procedure room by the same physician or other qualified healthcare professional following initial procedure for related procedure during the post-operative period. Okay, usually for the pacemaker, the post-operative period is at 10 days and he returned 2 days ago. So within 2 days he came back. It is an unplanned return because you don't expect that the patient will return so soon, and that's why 78 is required modifier. So patient require a battery change for a single chamber pacing cardioverter defibrillator system. The battery was taken out in a subcutaneous fashion and the new battery is placed. The cardioverter defibrillator was then reattached to the electrode which were intact and tested, and the skin pocket was then closed. How should this service be reported? Now let us have our option. So in this case, if you see the option C, this is the option for the pacemaker. So I will not, because this codes talk about pacemaker. Our system is defibrillator. It is a single chamber, and what we have done is we have taken the pulse generator out and we have put the new pulse generator. So that is the data that we have, and since the system is not a pacemaker, the C option is eliminated. Now we have option A and B and D. So let us begin with the option D. Option D is 33241, removal of the implantable defibrillator pulse generator only. Now here there are parenthetical note, and in that they have written do not report 33241 in conjunction with 33230, 33231 and 33240 for removal and replacement of the implantable defibrillator pulse generator. Use 33262. So this parenthetical note helps me eliminate two options. One is this option has gone because they have said I cannot use these two codes together, so this option has gone. Now in between again here also these two codes are there, so I cannot use them together, so this option has gone, and we have the code 33262, and here they have written use 33262 or 263 as appropriate when pulse generator replacement is indicated. So we have replaced the pulse generator, so we will use that option. So yes, the option 33262 is the correct option, and it is a combo code which talks about the removal as well as the replacement of the battery. Now this is the operative report. Whenever you are reading the operative report, the length of the report sometimes is quite intimidating. So whenever you are reading, try and read it, the important thing. Operation dual chamber transvenous implantable pacing cardioverter defibrillator system implantation with leads. So this is the defibrillator system. It is a dual system and they are implanting with the leads. So this is giving me enough clue that system first time dual system and they are putting the leads. So now you can come to the description and just go through the description whether you get some additional info. So after informed consent had been obtained, the patient has brought to the outpatient hospital lab in the fasting state. The left anterior chest was prepped and draped in sterile fashion. Intravenous sedation and local anesthesia were given. After the local anesthesia, 5 centimeter incision was made into left deltopectoral groove with a blunt dissection and cautery. This was carried down through the prepectoralis fascia. The cephalic vein was identified and ligated distally through the venotomy. A subclavian venogram was performed to provide a roadmap. The atrial and ventricular lead were then advanced into the vessel to the level of the right atrium under the fluoroscopic guidance. The ventricular lead was maneuvered to the right ventricular outflow tract and then through the RV apex where it was actively fixed. Good sensing and pacing threshold was demonstrated. The lead was anchored to the prepectoralis fascia with the interrupted 2.0 Ticron suture. 10-volt pacing did not result in diaphragmatic capture. The atrial lead was then maneuvered to the anterolateral right atrial wall where it was actively fixed. Good sensing and pacing threshold were demonstrated. Now the lead was anchored to the prepectoralis fascia. So all these things you will have to read it and gather all the important information. So we have the important information. It is a defibrillator, dual chamber, placing it for the first time. Come to the code. The first code is wrong because this is the code for the pacemaker. Our system is a defibrillator. So we have left with these three options. Now let's see what is the answer. So our answer is 33249. The answer D, because we are putting the dual chamber transvenous defibrillator system into the into the patient. And remember, the most of the guidances are included in this code. Pay attention to the code language. There are many combo code, and of course whenever the combo code is present, we'll always choose that code over the single code. And whenever the whenever the word permanent or temporary is not mentioned, we can assume it is a permanent. And the only way to master this particular topic is to do a lot of practice. So do a lot of practice. All the best. I'll be putting a lot of questions related with the pacemaker and the defibrillator so that you will master this particular topic.